In today's video, we are going to learn about the containers and the closures used for the parenteral preparations and also the processing of the parenteral preparations. So, first start with the containers and closures for parenterals. The containers used for the parenteral products are either made from glass or plastic materials. The pharmacopoeia requires the following conditions for a container and a closure to be used for parenteral preparations. What they are means? The first one is, it should not yield a foreign substance to the product. It should be a sufficient transparent to allow the visual inspection of the content in it. It should not have any adverse effects on the product. It should prevent the diffusion in or across the walls. So all these are all the requirements for the containers and closures used for the parenterals. And mainly there are three types of glasses are used for the preparation of the containers meant for storage of the parenterals. What they are means type 1 glass, type 2 glass and type 3 glass. First we will start with type 1 glass. It is also called as borosilicate glass or neutral glass. It offers a high hydrolytic resistance due to its chemical composition. It can withstand autoclaving and weathering. And next type of glass is type 2 glass. It is a soda lime silicate glass with high hydrolytic resistance as a result of treatment with moist sulfur dioxide at high temperatures. So the containers made from this glass are suitable for most acidic and neutral aqueous preparations. And next type of glass is type 3 glass. It is a soda lime silicate glass with only moderate hydrolytic resistance. The containers made from this glass are generally suitable for non-aqueous preparations and powders for reconstitution immediately prior to administration. So containers of type 2 and type 3 glasses should be used once only. Containers for human blood and blood components must not be reused. So next, coming to the plastic containers. So the plastics are the synthetic polymers such as polyethylene, polyvinyl chlorides, polypropylene, which are used to make the containers for the injectables. So the standards for the plastic containers for the parenteral products are given in IP. According to the IP, we will prepare the containers. Processing of the parenteral preparations. The following steps are involved in the processing of the parenteral preparations. What they are means, the first step is the cleaning of the containers, closures and the equipments. So first we will clean up all the containers and the closures whatever required for the pre-compounding or should be cleaned properly first. After that, collection of the material. So whatever the material which is required for to compound the product is to be collected first. And then next step is preparation of the parenteral products. So we will compound the product. By using those materials, we will compound the preparation according to the procedure. So after that, after compounding, next step is the filtration. Here, during filtration, so whatever the product we prepared is to be filtered here. After that, next step is filling the preparation in a final container. So this is an aseptic process. So maximum this process is done by machinery. So automatic, this is an automatic one. So next step is the sealing the container. After filling of the product into the container, we should seal the product properly. So that is the next step. After that, after sealing of the containers, we should sterilize them. So sterilization is done by automatic equipments are there. So by using those equipments, we will sterilize the product. So the sterility is the main objective of the parenterals. After the sterilization of the containers, we should have to evaluate the parenterals. After that, labeling and packaging is to be done. So this is all the procedure of the processing of the parenterals. We will see one by one clearly. The first step in the processing of the parenterals is cleaning of the containers, closures and equipment. All the containers, closures and equipments which are required during the preparation of the parenteral products are thoroughly cleaned with detergents and washing is done with a tap water followed by clean distilled water and finally rinsed with a water for injection. And then rubber closures are washed with a hot solution of 0.5% sodium pyrophosphate in water. So remember this point, that is 0.5% sodium pyrophosphate. And then the closures are then removed from the solution, washed with water, followed by rinsing with filtered water for injection. On small scale, washing is done manually, but on large scale, automatic washing machines are used. And the next step is collection of material. The various ingredients of the formulation of the parenteral products are weighed and collected in the preparation room. The raw materials required in the preparation of the parenteral product should be pure. Water for injection free from parabens and microorganisms are used in the preparation of parenteral products. After collection of material, the next step is preparation of the parenteral product. So here the pharmacist should decide the order of mixing and exact method of preparation to be followed before preparing the parenteral products. The parenteral preparation must be prepared under strict aseptic conditions. The ingredients are actually weighed separately and dissolved in the vehicle as per the method of preparation to be followed. After that, filtration. So the parenteral solution so formed is passed through the bacteria-proof filters such as filter candles, sieged filters, membrane filters, sintered glass filters. The primary objective of the filtration is to clarify the solution by removing the foreign particles. If the parenteral preparations are required to be sterilized by means of a bacteria-proof filters, filtration should be done under strict aseptic conditions to avoid the contamination of the filtered solutions before it is finally transferred into the final container and sealed. After that, filling the preparation into the final container, that is the next step. Here, the filtered product is filled into the final containers such as ampules, vials and transfusion bottles, which are previously cleaned and dried. Here, ampules are used for filling the single dose, whereas vials are used for filling multiple doses. Bottles are meant for filling the transfusion fluids. On small scale, filling is done by using a hypodermic syringe and needles. On large scale, filling is done by automatic filling machines. The sterile powders are filled into a container by individual weighing or by using a automatic or semi-automatic devices. The filling operation is carried out under strict aseptic conditions. During the filling of ampules, the care should be taken that the solution should be filled below the neck of the ampule, and the solution should not touch the neck of the ampule. This will prevent the cracking and staining of the neck of the ampule at the time of sealing. And the next step is sealing the containers. Sealing should be done immediately after filling. Ampules are sealed manually on a small scale by rotating the neck of the ampule in the flame of the Bunsen burner. So by using this Bunsen burner, we will seal the ampule in a small scale process. But on large scale, so the ampule sealing machine is used here, in which the tip of the ampule is fused to seal it. And the vials and the transfusion bottles are sealed by closing its opening with a rubber stopper. Simply by using these rubber stoppers, we can seal the containers here. And the rubber closures are held in a place by crimping the aluminum caps, which is done manually or by the mechanical means. Okay, this is about the sealing of the containers. And the next one is sterilization. So the parenteral preparation should be immediately sterilized after sealing in its final container. The sterilization is done by any one of the method of the sterilization, which depends on the nature of the medicaments present in the parenteral preparation. For example, if there is a medicament like thermostable medicament, so then we will adopt sterilization by autoclaving method at a temperature of 150 degrees centigrade to 160 degrees centigrade for 30 minutes or 121 degrees centigrade for 20 minutes, or in a hot air oven at 160 degrees centigrade for 2 hours. We will adopt these processes for thermostable products. Whereas in case of thermolabile preparations, we need to sterilize thermolabile substances means then we will use filtration method. So the thermolabile preparations are sterilized by filtration through a suitable bacteria-proof filters. Parenteral preparations which are sterilized by filtration method may contain a suitable bacteriostatic agents to prevent the growth of the microorganisms. When the solutions are used for intravenous or intrathecal injections in doses exceeding 15 ml, the bacteriostatic agent should not be used. The sterilized product is filled into the final container and sealed. The process of filtration, filling and sealing are done under aseptic conditions only. The finished parenteral products are subjected to the various tests in order to maintain the quality control like sterility test, clarity test, leakage test, pyrogen test and assay. After evaluation of the parenterals, the ampoules, vials and transfusion bottles are properly labeled and packed. The label should state name of the preparation, quantity of the preparation, manufacturing license number, batch number, date of manufacturing, date of expiry, storage conditions, retail price, manufacturer's address. So all these are needed to be mentioned on the label. So up to now what we learn means the processing of the parenteral preparations. In this various steps are involved. The first step is cleaning of the containers and closures. So whatever the containers used for filling of the product should be cleaned properly. After that, collect the materials whatever required for the preparation. After collection of the materials, we have to prepare the parenteral product using a standard procedure. After that, filter the product properly using various filters. After that, we have to fill the final solution into the container. So after filling the ampoules or vials, we have to seal them properly. So sealing is the next step here. After sealing, we have to sterilize these ampoules and the parenterals. Okay, so after sterilization, we have to evaluate those parenterals. Okay, so many evaluation tests are there, so I will explain in the next video. After properly evaluating all those parenterals, the next step is labeling and packaging. Okay, so this is all the processing of the parenterals. Is it clear? So that's all for today. Thank you for watching this video. Please subscribe to our channel for more videos.